This is kind of an interesting case. At first, a little confusing, so I thought I'd share it with you. Saw the patient in 2020. Patient was in pain. They had had a direct pulp cap, and the imaging showed kind of a strange looking area around it. Didn't know if it was from the wisdom tooth extraction, a lateral canal, or a fracture. The patient had occlusal trauma on the tooth, had had prior very bad dental experiences, had a limited opening and very low pain threshold. So it was a challenging case right from the beginning. This is my incredible drawing for the patient. TDO saves all your case presentation materials that you can always review with the patient. And then the clinical findings were verified what we saw on the cone beam. It was a C-shaped canal. Because of the limited opening, we used the YAP tool to do our instrumentation because it was very difficult even getting your hand in there. We did do a gentle wave on it because it was a C-shaped canal, did a minimal instrumentation, and got a halfway decent result. TDO gives a summary picture of all of the images, which is kind of nice. And it looked like the C-shaped canal was well cleaned and obturated. 2 years later, we take another cone beam at the recall, and the area had developed considerably, and we decided to extract the tooth because it was very close to the mandibular canal. Well, when we took the tooth out, there was an abscess attached to it. We removed that, and we'll be presenting some electron microscopy on it in a couple of weeks after that's completed. We took some angled x-rays of the extracted tooth. It looked like it had been obturated fairly decently, but it was fractured. You can see very clearly the fracture there, and you can probably see why it was fractured because of the way the crown was made. There's a wedging effect there. And so we basically wanted to examine the biofilm in the fracture. We cut the apex off just so we could kind of get a sense of how well it was obturated in the C-shaped. And it looked like the gentle wave did a pretty good job of removing all the tissue. It was filled with sealer. We used BCH sealer here and the gutta percha. And there weren't any obvious voids. It looked to be completely obturated throughout its length. And then we subjected it to electron microscopy, and I wanted to look at the canal walls along the fracture line just to see what the biofilm looked like along a fracture line. So I cut into the root where you see the line and fractured that piece off, and then we could look at the biofilm along the fracture line and get a pretty good look at what that biofilm actually looked like and see if any of it actually went into the canal. So these are pictures of the split section, and you can see it almost looks like plaque along the fracture line there. And we subjected that to some electron microscopy and looked at it very closely because obviously this was a biofilm that had been present for quite some time and is useful understanding what biofilms look like after they've been present for a long time. So when we went into the axial view, you get a pretty good sense of all the crud that was along the fracture line, and you get a pretty good understanding of what biofilms look like after they've been present for a long time. And if you look closely at this, it isn't only a bacterial biofilm, but there are many fungal morphotypes here as well. So there's a considerable fungal and bacterial presence along the fracture line. Those are all fungal morphotypes, or actinomycosis hyphae. But pretty much everywhere we looked along the fracture line, there was this kind of biofilm present. And we've been talking about how to recognize biofilm in the EPS. So this gives you a little more experience in recognizing biofilm morphotypes that are embedded within EPS. And we took a look at various places along the fracture line. And here you can see the EPS and the bacterial and fungal morphotypes that are embedded within it. So it gives just another example of how to identify bacterial biofilms. Now we're actually in the canal, and we wondered whether the bacteria could actually get into the canal. And you can see here, if you're paying attention to our bacterial biofilm cases, you can see the EPS and the goo that they excrete along the dentin, and that's how they attach to the canal wall. So we looked at various places within the canal. I did not see any tissue within the canal at all, so it looks like the gentle wave did a pretty good job of removing the tissue. But encrusted on the canal wall was bacterial biofilm. There you can see the fracture plane. And you wouldn't expect the irrigation device to be able to remove any of that. Here's just another example of the EPS and how the biofilms present, so you can improve your pattern recognition. When we did look at the apical segment, I was interested to see, because there was a lesion attached, but I was not able to find any evidence of a bacterial biofilm in the apical millimeter of the root. So I guess that's good news.